We do have another caller, and let me ask Cindy, who's screening our calls tonight. I'm sorry, it was Barbara. Okay, where's Barbara from?
I'm from Charlotte.
Okay, welcome.
Thank you, and thanks for taking my call. It's coincidental. Last night I was speaking with a friend who had this eye corrective or vision corrective surgery 15 years ago.
Which one? Which one?
I don't know. She was. I don't know. She didn't know the name of it. She said it's not called LASIK. It was not called LASIK, and basically she was. Finding out now that even though our surgery was to correct, I think, farsightedness, she's finding now that even with reading glasses, she's unable to read anything up close. And is that something correctable?
How old is she approximately?
I'm sorry?
How old is your friend approximately?
About 50.
Okay, great
well, this is
question.
a very good question, and I see patients like this all the time. Probably this person had RK, which is an incisional technique, and probably as she's aged, she's become a little farsighted from the RK. And then being over 40, on top of that, she has the presbyopia. So she would need either a bifocal for correction, or it may actually be a candidate for the ReSTOR procedure, which actually restore her distance and her near vision. And with the little model that I showed earlier, there are two optics. And so we do careful measurements of the dimensions of the eye, and we have the ability to choose the power of the optic to correct the distance vision as well as the near vision. So she actually may be a candidate for the ReSTOR procedure. And I have a lot of patients from years ago that we corrected the distance vision with RK, ALK, PRK, or LASIK even, and now they're coming back over the age of 40-something, picking up reading glasses, and we can actually do the ReSTOR procedure for them.
Okay, well, I thank you for that answer. I was curious, do you consider this permanent, this current procedure that you do now?
I was just going to ask the same thing to follow up with that. You're right.
That's a very common question because as people age, they tend to pick up higher and higher power reading glasses as they age, just normal. So if you're 40, you might need a +1. If you're 50, you may need a +2 or something. Well, it's the lens inside the eye that's deteriorating. So once that lens is replaced with acrylic plastic lens, the eye really is stable.
So now, you're good to go.
You're good to go, and it's permanent.
Right. Well, thank you so much for your information.
It's our pleasure.
I'll tell my friend. Bye.
And you and I were talking, and I was under the misconception. I know just this much about how the eyes work, but there are muscles that control the lens.
The lens.
And I thought as you got older, it makes sense to me that the muscles would get weaker, but you said that's not really what's happening.
Well, the theory on that has changed back and forth probably over the last 100 years. And the most prevalent theory now is the muscles and their attachments to the lens still work, but the lens itself has become more rigid or inflexible.
So it doesn't respond as much to what the muscles in the brain are trying to tell it to do.
That's right. So it becomes thicker. And it's really aging of the lens. It's having the need for reading glasses is almost a pre-cataract situation, where the lens is still clear, but has become inflexible because it's become thicker. Then as you age, that hardens more and more to the point where if you're 80 or 90, it might become opaque. Well, so it's a normal deterioration of the lens.
But do you have anybody who doesn't need reading glasses then, who theoretically would not develop cataracts?
Well, if we all lived long enough, we'd probably all develop cataracts. And then there are some people, because of the shape of their cornea or their lens has aged more gracefully, may not be picking up reading glasses until their late 40s. There's an occasional person. And then there may be someone, the month they turn 40, they start picking up reading glasses.
Another interesting situation, my own, if I may, one eye is nearsighted, one eye is farsighted. So I don't need...
You monovision.
Is that what it's called?
Yeah, some people do monovision, where actually with contact lens or with LASIK, you can't really do it with glasses. And that's where one eye is corrected for distance and one for reading. And it's not uncommon that that is done. If you take 100 people off the street, have them try that, probably 95% of people couldn't do that. They would feel imbalanced or whatnot.
Really?
So if we do that with the laser, we want to make sure they've tried that monovision, they like that. And usually it's because someone has become contact lens intolerant. Now, it's interesting in meeting people that have monovision, it's not perfect. It's a compromise, really, because you give up distance vision in one eye to read with. And some people don't like it, even though they do it. They do rather do that than reading glasses. So. That's right. The two sides of your brain are connected.
Oh, don't say that.
I'm teasing.
I know
but
you are.
I have converted a lot of monovision patients to the ReSTOR Resume multifocal, and they like it
and
better.
It just takes care of everything.
Because both eyes see at distance, both eyes read it close. And then as you age, then the monovision may not give you this intermediate.
I have started to notice that, in fact.
And that would be better with the ReSTOR Resume combination.
Here at Christenbury Eye Center, we use only the latest, most advanced technology, like our all-laser eye LASIK procedure, to help you achieve incredible vision. It's the safest, most precise technology available. Don't wait. Call us today.